Hello and welcome to Beyond the Mirror podcast. Today I have a very interesting and special guest, Leanne Banks. Leanne is a qualified psychotherapist with a first-class degree, but also she is a very good patient of Angels 12 Clinic. And during her appointments, we have had a conversations, which is where we were discussing psychological impact and connection between our appearance and our mental health and well-being. So we decided to bring this conversation into the podcast because what we have been discussing in clinic has been very intriguing. Welcome, Leanne.
Thank you.
Leanne, could you please tell us a little bit about yourself, your background and your expertise in your field?
So I hold a degree in humanistic integrative psychotherapy, and I'm also a registered member of the BACP, which is an important organisation that holds psychotherapists to a degree of ethical practice, so which is very important when you're dealing with vulnerable people.
Oh, absolutely. And Leanne, I'm very interested, and I'm sure so is our viewers and listeners to hear your perspective on how our appearance impact psychological health and mental well-being.
Yeah, so it's one of the most important parts of really valuing yourself. So what we put out into what we lead with as our image for everyone else to see is really important for us to feel confidence and self-esteem. So that can be greatly impacted by the way what we see in the mirror, for instance, might not reflect how we feel about ourselves inside.
Do you get this often when people come to you and they affected by the way how they look? So that is the reason why they feel low, depressed, anxious.
Well, I'd say that often I get people coming to me who have noticed how they feel more than actually how they look to begin with. But that quickly turns into, the looks can be sort of something that they feel like they can perhaps change and bring more self-esteem to how they feel about themselves, how they value themselves, and how they put their image forward into the public or into whatever environment they're going into, like their workplace or their social life. So it's really important that they feel that congruence about what is happening inside matches what they see in the mirror.
And would you be able just to give us a little bit of an idea? For example, I have never been to a therapy session. I'm just intrigued to know how does it work? So do your patients or your customers mainly talk? You ask leading questions? What is a typical session of psychotherapy looks like?
Yeah, so when people come, they'll normally have an idea of something that's worrying them, something that's troubling them, maybe stopping them from moving forward in life. And so we have a discussion about what that is and what's happening in the present day. And in the first sessions, obviously, there's a little getting to know and sort of creating that connection between the therapist and the client so that there's a level of comfort and safety to share. So, and further on in the work, we might look backwards and think about what is it that affected them during younger years that links to how they may be processing their feelings in the present. So there tends to be a familiar pattern that sort of picks up in the present that may be a emotional response to certain things that keeps on happening, repeating, and creates a stuckness or a feeling that they can't move forward. And a lot of the time, this is to do with self-esteem, trusting themselves to be able to make decisions and also to feel good and feel valued in themselves rather than seeking that from external sources, like perhaps when you might think about when people are saying things or feedback to you that you might take as criticism and sort of really sit with that for far too long, really.
Or sometimes people trying to find recognitions through that as well, rather than just finding it in themselves. Am I right to say that?
Yeah. So sometimes in conversations, people may pick up on feedback that they turn into a self-criticism later on and sit and sort of really value more what other people are thinking or saying than trusting within themselves what they think and feel and value about themselves. So sometimes when that part's missing, it tends to be focused on what others are doing. So when we think about appearance, if we're making an appearance look in a certain way that we feel like we can belong and fit in with others, then we place a lot of importance on that rather than actually feeling good about within
ourselves. So from what I understood, that a lot of your work involved conversational practice with patients and trying to them come to peace with themselves and find probably the problems which could be related to the past, present, and things like that. In your professional opinion, do you think that integrative therapies, for example, fitness, practices of self-care, meditation, do they help? Do they have a place around mental well-being, and especially when the patient or a person at the stage where they do need help and they come to you, would you say that also can play a positive role on their recovery and support their well-being?
Yeah, absolutely. So as a practitioner, I would be looking at the whole person and what they do in their life. So when you're mentioning sort of exercise and all the things that are really important to be able to feel good about yourself in moving forward, those meditation you were mentioning, so that there's a really good alignment with things like journaling and making sense of one's thoughts. So through meditation, reflection, slowing things down, feeling safe about being within those thoughts. They're all really important parts of being able to get a sense of yourself and develop more self-awareness, so that really knowing what emotions you're actually feeling at any time. Sometimes emotions can be very painful, so there can be a process of just pushing them aside and not processing what they mean, and being able to reassure yourself it's okay to feel sad or disappointment, or even recognizing those positive feelings, that those are all really important parts of developing self-awareness, to know actually I don't feel good about this, or I feel great about this. And that helps us to really get a sense of where we're at.
In our practice, we often get patients, especially women, around menopausal age, and they come to us often not because they're concerned about looks specifically, but they just don't feel confident or happy in themselves. And some often might take some antidepressants or feel low. Do you find or came across in your practice that people who come to you at the same time seeking help through improving their body image, improving their face, and have you seen cases where those practices have been successful?
Yeah, so there's the big life changes that you're talking about. So people who may have been through illnesses as well, menopause, like you're talking about, different life changes, like perhaps going through a divorce or something like that. Those can be big knocks to self-confidence. And some of the things that people will do as a real sort of like, oh, what could I do to really help boost my self-esteem, will tend to be around, oh, how am I looking? So you might go out and buy new makeup, or you might go out and buy a new dress, or do something that's actually within your control to actually have a sort of like a quick win, I guess, like to boost. So yes, that part of really sort of developing some more self-value, touching on that feeling, is really important. And the aesthetics and having treatments and even having facials, massage, all sorts of things that come along with that, with the beauty realm, they can be really helpful in just boosting that feeling within, and perhaps getting you back on a bit of the right track.
Yeah.
But where I would come in with that would be to really delve into how you connect with that, and how can you develop contact with those feelings to really bolster that self-esteem. And are you doing these things for yourself, or do you feel pressure externally from maybe others to fit in, or any other source of pressure that you feel like you must look a certain way?
I think these days society and especially internet, social media put a lot of pressure on a young patient, on that there is a certain image that's accepted, and I think a lot of young people are mentally affected by that. Would you agree with me?
Yeah, I think that's really a really tough place to be at the moment, especially with social media, and coping with the bombardment really of how you should look is a difficult concept to try and stay really true to your own identity and actually develop your own identity amongst what is told to you that you must look like to belong. It's a very difficult place to be for young people.
And when you work with your clients, would you recommend them to reduce their time on social media? Do they ever come to you because this part of their life have an impact?
Well, when it comes to me sort of recommending things, my philosophy and how I work is about humanistic integrative. So it's kind of like drawing on really thinking about what is it that you're doing in your life? What are your choices? What is the impact? So rather than me making those recommendations, we would use those examples as exploration to see what impact does it have when you're maybe scrolling for hours? What do you feel when you're doing that? And then maybe what do you feel after? So that then it becomes a choice for that person to make adjustments that fit right for them. Because it might be right actually that they do take some inspiration from what's going on and making use of advanced technologies in this day and age. There's a lot of things that can be positive about that, but it's striking that balance between what is helpful and what becomes a different story for them, something that actually feels quite negative or induces more self-criticism.
And I also would like to explore a cultural differences because Britain is a multicultural country. We have people from different social economic background, from different ethnic background, different cultures. Would you say that you see a difference in cultural approach, how people deal with the struggles, especially mental health?
Yeah, so culturally, I think that that would go back to sort of family dynamics in my work, is how I would sort of try and understand how growing up in a family that may have different traditions to what would be considered a British culture, which is changed so much over the years. Like there's so many different things to consider in that. So yes, I mean, I do have to really adapt my approach to what is going on for that person individually and their background.
Okay, that's very interesting. And sometimes people see British culture as very like private, close. Do you think that this impact or make your burden on mental health more severe? That you're not necessarily very open to other people, maybe less so sociable, keep yourself private. And is it positive or negative for your well-being?
So do you mean that sort of some people can become a bit more isolated?
They are more like isolated, private. For example, like I don't know if you would look at Italian culture. It just seems they're very emotional. They shout. They put if they're happy, you will see it straight away. If they're angry, you will see it straight away. I'm from Ukraine. I'm Eastern European. We know that some people see us probably as a little bit rude sometimes, but I think we are emotional, and we're not very good at hide our emotion. When I think British people is very classy and they very well at keeping their emotion under control. For example, like I think sometimes I could be ice and fire within a 5 minutes. When you're not typically will see it as a stereotype, I would say, in the UK. So am I wrong to think that? And does that have any impact on your well-being? Is it better just to throw all your emotions, scream, shout, make other people know about how you feel, but then you feel good about it 5 minutes later? Or is it better to keep it inside and then build it up and then work yourself through that struggle without sharing it with others?
Yeah, so I think it's a balance about what, everyone has emotions, and how you express them is really individual to you. So I guess where I'm talking about that balance is that if there was a sort of like a screaming and shouting kind of thing, that actually you could probably imagine that for that person, they're feeling quite dysregulated and feeling quite uncomfortable in expressing that amount of emotion. But equally, for somebody who's quite controlled, that they may be really struggling holding all of that emotion in. And I feel like that where things come to a head is perhaps afterwards, on reflection, that the person that's kind of like outwardly expressing emotion may reflect on that differently and be, I really wanted to hold myself a little bit more in that moment, and actually it felt really uncomfortable. And the person that is a little bit more controlled, or very controlled, may actually not be in touch with any of that emotion, and holding it in could sometimes lead to overwhelm later, much later, but a bigger overwhelm, maybe something that leads to isolation, and lower forms of depression. So there's a balance of being able to, what I work with is being able to be in touch with what you're feeling at a time, so that you can reassure yourself in those moments that you're okay, you're experiencing a feeling, the feeling belongs to you, it's not necessarily reality. So being able to process that in a way that feels a little bit more balanced and easier and more comfortable to manage, rather than your feelings overtaking, either with an outward outburst or with holding a lot in.
You mentioned a word depression, and I just would like to dive in a little bit more into that, because this is a very common problem today. But how we need to recognize what is the true depression is, when it's require attention, and when it's probably just a little bit over exaggerated and not necessary a problem as such. Is there is any kind of signs? Because I think knowing a little bit more about this might help some people to get the help at the right time, or realize actually at this stage I need just to work a little bit more on myself.
Yeah, so everybody feels sadness and disappointment, and that sometimes they may describe it as feeling depressed. And I guess there's a difference between feeling depressed and actually being clinically depressed.
That is would be really nice to explore what's the difference.
Yeah, so I would sort of, just to maybe align it with a spectrum of sad feelings, with sadness and disappointment, and then depression sort of being at the end of that scale. But I feel like that sort of the clinical depression is one that is diagnosed for a start, and it's no longer just a feeling on a spectrum of sad feelings, that it's something that's possibly debilitating and may stop you from getting out of bed, may stop you from leaving the house, may stop you from doing the things in your life that feel like you're still moving forward, that there's a very stagnant feeling about that, and a very overwhelming feeling of sadness that goes with that, something that really stops people in their tracks.
And if people truly depressed and it's a clinically diagnosed depression, is that is still within your expertise to help them, or would you work alongside with the doctor together to get the person back on track?
It depends on if it's a crisis situation. So of course, with depression, there can be areas of self-harm that are going on, and issues that wouldn't be appropriate for therapeutic intervention. They would be, well, not in a psychotherapy sense. So there may be more interventions required to keep that person safe, in the very sense of survival, really. So that may be, intervention with medical intervention, and maybe psychiatrist intervention. So therapy that I practice is not suitable for people in crisis, where they may be at risk of harming themselves or others.
And also, another, it's maybe a bit of a controversial question, but would you agree or disagree that these days depression is often overdiagnosed. It's people saying, "Oh, I'm depressed, I'm taking antidepressants," and more importantly, I think antidepressants prescribed too easily, maybe in many cases completely unnecessary. Would you agree with that, or you think that's not necessarily the case?
Well, I think that actually in recent years, there's been a lot of highlighting the importance of mental health, which is a really positive step of bringing it out of the shadows and really talking about it as something that affects everybody, because we all have emotions and we all struggle with emotions and have difficulties at some points. So it's really important to recognise that talking about it is great. Those advanced moves in that way have been really welcome. And then I think that where the thing comes from about overdiagnosing, or maybe that dialogue or the narrative around that, is that actually we start to use that language a lot more to describe our feelings. So I find the same with anxiety. So people may say, I have anxiety rather than I feel anxious. So I have depression rather than I'm feeling depressed. For me, they feel quite different in terms of one can be a diagnosis and the other is talking about describing feelings. So in my work, that is that kind of really defining what are you feeling. So creating dialogue for my clients to really connect to what are you feeling and how do you describe that. So getting back to that point about sort of the feeling is that we hear a lot about people who have depression or have anxiety, that I feel like quite often that's a way that they're describing feelings rather than having a diagnosis.
So, and it's often also what I understood, it's probably just not correct use of terminology as well, rather than how you feel, you just almost confirming that that is what you have.
Yeah, so we like our feelings can be so intense that we do really struggle at points. So describing them as I have anxiety or I have depression feels like a natural way of doing that. But there's also that other side to it where they are actually clinical diagnosis, and so there can be a bit of a crossover there. And although that would be my view, I am curious if that's actually the case, because I haven't conducted a study on that, but it's just the kind of temperature that you notice in society about how it gets talked about.
Yeah, absolutely. Leanne, I'm very looking forward to ask you a question that I ask every guest, but I specifically want to hear your point of view to that. So do you believe that when patients come to our services, medical aesthetic practice, for example, cosmetic dental clinics, and they have good results, they're happy with their appearance, that this impact go much further than reflection that they see in the mirror? Would you agree with that?
Yes, yeah, absolutely. I think that we have feelings about our own self-criticisms that we like to combat with taking action. So if, I didn't like my hair, I might go to the hairdresser. So there's an action for that to bring more confidence immediately, really, so that can help to fill that self-confidence, that self-esteem. And those feel like quite regular things that people may do to actually notice, well, I'm feeling a bit self-conscious about this. I might make a change, or I will make a change.
And would you agree with people who believe that also this sort of things is vanity?
Well, what is vanity?
Looking after yourself,
so
taking care of yourself. Some people would say going to a hairdresser regularly is a vanity. Putting your makeup on is vanity. Others would say having cosmetic treatment is vanity. Sometimes I hear it from my patient, oh, am I too vain to kind of thinking about wanting to look better? So I just want to hear your professional perspective. What do you think?
Well, yeah, so when I hear the word vanity, it feels like that's quite a negative concept, really, about perhaps upholding beauty over everything. But that's not what I'm hearing here. It's more about taking steps towards feeling good and looking good, and not sort of forgetting everything else in life. It feels more like that what self-care is about feeling good about yourself and being able to be the best version of yourself that you can be.
But on the other hand, I would say if you wake up and you look in the mirror and you feel confident and happy, would you not be a better person, better wife, better mother, better daughter, better work colleague because you feel content? Rather than you woke up and you look tired and you feel like you really don't want to do anything, but you need to, and it feels like a chore rather than, part of your life and part of your days that you're enjoying and you are thriving through it rather than surviving.
Yeah, so I mean, it reminds me of that analogy of the oxygen mask when you're on the plane. So fit your own mask before you're helping others.
Yeah.
So if you can really feel good about yourself, then outwardly you are going to get the benefits of contact with people in a positive way. You're going to feel good about what you bring to the day. So it's more about noticing. If you can notice that actually if I go and get my hair done today or I go and have a facial, I know that I'm going to feel good about that. I'm going to feel good about that in myself, and then I'm going to be able to have better relationships with others. I'm going to be able to bring that positive part of me that is beneficial to not just me, but to my family and my close friends. So it feels like that actually knowing what you need, and if that's a treatment or having your hair done, that's a really great thing to know, just as it is to be in contact with what your emotions are.
So much like how you describe it, that situation on the airplane, help yourself before you help others, because I think if you not fulfilled, how you can fulfill the others in the same way. But then leads me to another interesting question. Often we hear, especially from women, because I think we're trying to do a lot and carry on the shoulder, especially being mom, being a wife, run the house, work. And often when the kids are grow up, when we're becoming a little bit older, we realize we sacrificed a lot. I hear this word very often.
Yeah.
So from psychological point of view, what sacrifice does to us? Is it good? Is it bad?
Yeah, so it comes back to that balance again. So if you feel like that actually you're sacrificing too much, resentment can build. So you start to, in those moments, feel feelings maybe of resentment. They can build up. I'm not saying it's the same for everybody, but that is something that I see a lot, is that when one person may be a carer, the mother, or and obviously you probably see a lot more women in your clinic, that they do start to feel resentment against doing all of these jobs and not really having time to take for themselves. Their selves kind of get lost a little bit. So having, treatments and things that actually bring back that sort of connection to self and ring-fencing that time as time for you, as self-care really, taking that time to slow down, reconnect with yourself, give yourself a treat, give yourself a break, is really important to be able to bring back those feelings of actually, I'm a really good mum, I'm a really good partner, I work really hard, and I deserve to take some time out and reconnect with myself.
It's almost coming back to balance, but do the real balance exist?
So the balance, well, that's where my work comes in. So sometimes people will come and it is about out of balance. So quite often emotions are out of balance. And when emotions become overwhelming, they have a feeling of controlling us so that we can't move forward anymore in the ways that we have done or we want to. So readdressing and exploring where those emotions are coming from. What is it that is happening that is repetitive, and perhaps sort of stopping that cycle at some point so that actually you can have a look at the bigger picture and bring it back to the here and now, to reality. Because feelings are so important, they are our feelings. They're designed for only us. No one else can feel them, only you can. And so whilst they're important in informing us how we are feeling, they are not reality. So sometimes we need to really bring it back to the here and now. What is going on right now? And is this feeling something that's happening now, or perhaps something that I brought from younger years or a little while ago, or even trauma? So it's really important to view balance as a way of understanding emotions rather than trying to get rid of them or to experience them in a way that is negative. It's an exploration into and a journey.
Well, thank you very much, Leanne. This is I think, so interesting and make me look from a different angles on certain things, even in my life. I think I really enjoyed this conversation with you. I often say that practice what you preach. And I'm sure, well, I know you applying some practices of self-care into your day-to-day life. Coming to our clinic, one of those. Can you please share with us as little or as much about it as you would like and feel comfortable, and most importantly, how it made you feel?
Yeah. So, I mean, coming to the clinic myself and, well, indulging in some self-care around appearance has been a really positive experience for me. So everyone's getting older, and so approaching those years of life where you're sort of thinking, oh, I think I've got a little bit more that I want to experience and try in a younger sense, maybe not ready to let go of the youth a little bit. So it feels important to me to actually just keep what I was saying before about looking in the mirror and actually feeling that inside, so that you're matching up really. So I know that sort of approaching the older years, people struggle with that a little bit. So there's this balance again about trying to balance out reality. There's a realistic aging process, and that's fine. And I would like to embrace that in a way that feels fair. So of course, trying to have treatments and maybe make little tweaks here and there that are going to make me feel good about myself, I can approach those years with a little bit more confidence that actually I have a little bit of control in the situation. It's not going to just happen to me. I can be part of the process and also come to terms with natural aging.
Well, I think I quite like about being in control, so that you are having a choice these days, and you have a choice of taking control of aging process in a way how you probably like it to be.
Yeah, so in a more realistic way. So I would like to have treatments that can enhance my stage of life rather than change how I look. So that would be my aim, and I have had some treatments in that way to enhance looks rather than to bring about a completely different look. So that's for me about really understanding yourself more and being comfortable with the choices that you make that are not risks that you think, oh, I don't know if I should do that because I'm really not sure about the outcome. That feels like a risk that might be too great to take because it's taking me away from enhancement into change, perhaps.
And probably taking you away from who you are?
Yes. So I want to be me. So I'd like to just really be the best version of me that I can, and know that actually from buying a dress, going to get new makeup, or having a beauty treatment, that, all of those are things that are going to be helpful to my self-esteem and confidence and really make me feel great about myself.
Well, amazing, and I believe you do feel good.
Yes, yeah.
Leanne, I think it has been very insightful conversation with a lot of useful information and tips and recommendation, but might be people there who need help and who want your advice. So where those people can find information about you and how they can approach you?
Yeah, so I'm registered on counsellingdirectory.com, so you can find me on there. I have a profile with lots of information, and I also have a website, leannebanks.co.uk.
Thank you very much, Leanne. It has been a great pleasure.
Thank you.